Thank you for being here today as we explore the topic of post-orgasmic illness syndrome or POIS. This condition presents a range of symptoms that can significantly impact the lives of those affected. Let's delve deeper into these symptoms and the challenges they bring. One of the most striking aspects of POIS is the cognitive dysfunction experienced by men with this condition. Imagine the frustration of having difficulty concentrating, memory problems, and aphasia, struggling to find words or express yourself. This cognitive impairment can affect various aspects of life, from work to social interactions and academic performance. It is a daily battle that requires resilience and understanding. The physical toll of POIS is equally burdensome. Severe muscle pain, weakness, and fatigue plague those with this condition. It is as if their muscles are constantly aching, as if they just completed an intense workout. Engaging in regular activities becomes a challenge, as energy levels plummet. It takes immense strength to push through the exhaustion and carry on. But the challenges do not stop there. POIS can also bring about flu-like or allergic symptoms. Fever, chills, sweating, and a general feeling of being unwell become all too familiar. The body's immune response seems to be triggered after orgasm, intensifying the fatigue and weakness already experienced. It is an uphill battle against physical discomfort. Headaches, dizziness, and a persistent feeling of heaviness in the head add to the already overwhelming symptoms of POIS. It is like walking through a fog, making it difficult to concentrate or focus on tasks at hand. The world becomes hazy, and clarity feels out of reach. Eyes become another source of discomfort for individuals with POIS. Burning, redness, blurred vision, and eye irritation become part of their daily reality. It is hard to find relief when even the simple act of opening one's eyes is met with discomfort. Nasal congestion, runny nose, and sneezing add to the physical challenges faced by those with POIS. Breathing becomes difficult, and the nasal passages feel perpetually irritated and stuffy. It is a constant reminder of the toll this condition takes on the body. Throat-related symptoms further compound the discomfort. A foul taste in the mouth, dryness, sore throat, and a persistent tickling cough make communication a struggle. Expressing oneself becomes a challenge, and the discomfort lingers. Muscle-related symptoms complete the picture of POIS. Tension in the back of the head, muscle weakness, pain, and a sensation of heaviness in the legs further contribute to the overwhelming fatigue. Physical movements become arduous, and even the simplest tasks feel like an uphill battle. It is crucial to remember that each person's experience with POIS is unique, and the combination and intensity of symptoms may vary. However, an anonymous online self-report study found that 80% of respondents consistently experienced a cluster of symptoms, including fatigue, insomnia, irritability, and difficulty concentrating. The impact on physical well-being, mental health, and overall quality of life cannot be overstated. Living with POIS is a daily struggle. It can lead to social isolation, decreased productivity, and a sense of diminished well-being. Seeking medical assistance is crucial to receive the necessary support and management strategies to cope with this condition. Together, we can work towards a better understanding of POIS and provide the support and care needed to improve the lives of those affected. As we delve deeper into the topic of post-orgasmic illness syndrome, let us explore some additional aspects and implications of this perplexing condition. While the exact cause of POIS remains unknown, researchers speculate that it may be related to an autoimmune response or an abnormal release of certain chemicals in the body after orgasm. It is important to note that POIS is a distinct medical condition separate from psychological disorders or sexually transmitted infections. One of the striking features of POIS is its wide range of symptoms, which can affect multiple systems in the body. This heterogeneity makes it challenging for healthcare professionals to diagnose the condition accurately. Furthermore, the intensity and duration of symptoms can vary from person to person. Some individuals may experience mild symptoms that resolve within a few hours, while others may suffer from severe symptoms that persist for days or even weeks. POIS can have a profound impact on the overall well-being of those affected. The severe fatigue and exhaustion experienced by individuals with POIS can be debilitating, leaving them unable to carry out their daily activities. Imagine the struggle of dealing with persistent muscle pain, weakness, and a constant feeling of being drained of energy. It can severely limit one's ability to work, engage in social interactions, or even pursue personal hobbies and interests. Cognitive dysfunction is another distressing aspect of POIS. Men with this condition often report difficulties with concentration, memory, and verbal communication. It can be incredibly frustrating to find oneself struggling to find the right words or feeling mentally foggy after orgasm. This cognitive impairment can impact professional performance, academic achievements, and even personal relationships. The flu-like symptoms associated with POIS can be particularly challenging to manage. Individuals may experience fever, chills, sweating, and a general sense of feeling unwell, akin to having the flu. This can lead to a cyclical pattern of illness, where individuals feel relatively normal before ejaculation but experience a significant decline in health and well-being afterward. The impact of POIS extends beyond the physical realm. Many individuals with POIS experience emotional distress, including irritability, anxiety, and even depression. Imagine living with a condition that not only affects your body but also your mood and emotional stability. It can create a vicious cycle, where the symptoms of POIS exacerbate psychological distress, and in turn, worsen the physical symptoms. Sadly, the awareness and understanding of POIS among healthcare professionals and the general public remain limited. Many individuals with POIS face skepticism or dismissive attitudes when seeking medical help. This lack of recognition can further contribute to feelings of isolation and frustration for those living with this condition. To address this, it is crucial for healthcare providers to stay informed about POIS and its potential impact on their patients. By familiarizing themselves with the symptoms and understanding the challenges faced by individuals with POIS, healthcare professionals can offer the necessary support and treatment options. Additionally, increasing public awareness can help reduce stigma and provide a supportive environment for those affected by this syndrome. Now that we have discussed the various aspects of post-orgasmic illness syndrome, it is crucial to explore coping strategies and the role of abstinence in managing this condition. While there is currently no definitive cure for POIS, there are several approaches that can help individuals cope with the symptoms and improve their quality of life. It is important to work closely with healthcare professionals who specialize in sexual medicine or urology to develop an individualized management plan. Here are some strategies commonly recommended. First, abstinence. Many individuals with POIS find that abstaining from ejaculation or orgasm is the most effective way to prevent or reduce symptoms. By refraining from sexual activity, individuals can minimize the occurrence and severity of the post-orgasmic symptoms. However, it is important to note that complete abstinence may not be necessary for everyone, and some individuals may find that spacing out ejaculations or practicing sexual moderation can also be beneficial. Second, medications. Certain medications may help alleviate symptoms associated with POIS. Antihistamines, such as cetirizine or loratadine, can be prescribed to reduce allergic or flu-like symptoms. Non-steroidal anti-inflammatory drugs like ibuprofen may help alleviate muscle pain and headaches. Additionally, selective serotonin reuptake inhibitors (SRIs) or other antidepressants have been used to manage symptoms by modulating neurotransmitter levels in the brain. Third, lifestyle modifications. Adopting a healthy lifestyle can have a positive impact on managing POIS symptoms. Regular exercise, a balanced diet, and sufficient sleep can help boost overall well-being and reduce the severity of symptoms. Managing stress through relaxation techniques, such as meditation or deep breathing exercises, can also be beneficial. Fourth, support and counseling. Living with a chronic condition like POIS can be emotionally challenging. Seeking support from friends, family, or support groups can provide a much-needed outlet for sharing experiences and coping strategies. Professional counseling or therapy may also help individuals navigate the emotional impact of living with POIS and develop effective coping mechanisms. It is important to remember that each individual's experience with POIS is unique, and what works for one person may not work for another. Finding the right combination of strategies may require some trial and error. Patience and persistence are key in managing this syndrome effectively. Now, let us address the significance of abstinence in the fight against POIS. Abstinence, or refraining from ejaculation or orgasm, can be a valuable tool in minimizing the symptoms of POIS. By avoiding the triggering event, individuals can prevent the cascade of physiological and immunological responses that lead to the debilitating symptoms. Abstinence allows the body to rest and recover, reducing the strain on the immune system and minimizing the release of inflammatory mediators that contribute to symptom onset. It is important to recognize that the decision to abstain from sexual activity is a personal one and should be made in consultation with healthcare professionals and in consideration of individual circumstances and needs. However, it is essential to note that long-term abstinence may not be the only solution for managing POIS. Each person's experience with POIS is different, and some individuals may find that they can engage in sexual activity without experiencing severe symptoms. Working closely with healthcare providers can help individuals find a balance that suits their specific needs and goals. In conclusion, coping with post-orgasmic illness syndrome requires a multifaceted approach, including abstinence, medication, lifestyle modifications, and emotional support. By adopting a comprehensive management plan tailored to individual needs, individuals with POIS can strive for a better quality of life. Remember, the journey may be challenging, but with the right support and strategies in place, it is possible to navigate and thrive despite the challenges posed by POIS. Thank you for your attention, and let us continue to foster understanding and support for individuals living with post-orgasmic illness syndrome. Together, we can make a positive difference in the lives of those affected by this condition.